speak to some people, it's their first time in treatment. How important is that love for somebody who is their first time going in a treatment facility? It's brand new to them. How important is it to have for them to see and feel that love and special attention?
It's always been super important, and one of the first things we worked on. But today, because I'm going to jump into the COVID situation, because of COVID, a lot of people don't really understand how bad it got. So I'll paint a little picture. You're from South Bend, Indiana, let's say, and you have 3 feet of snow outside. You can't go to work because of COVID. You're at home. All your friends were at work. You had this family at work, like a lot of people do. You can't go to the office. They might live by themselves or with a spouse. And then what starts to take place is I'm lonely, I'm depressed, and I start drinking. And then it continues and it gets worse and worse and worse and worse until it breaks, right? And then they call up and they call the admission line and we get them in. And this is a story that we see, and it's really sad because our average client today is about 40, let's say mid 40s. We've had a lot of 60-year-olds come through the program. And we just take our time with them and understand them. And we have a thing that we do, which probably a lot of centers do. Within the first 24 hours, one of the staff members has got to bond with that person. It's so important. Remember, I was in South Bend. Now I'm in California. I'm uncomfortable. This is new territory to me. I'm a little insecure now because who are these people? What is this thing, right? I've never been to recovery house, right? So we really emphasize a lot in bonding and clicking right away to make them feel comfortable. No judgment ever, period, across the board for anybody, because we're not here to judge. We're here to love, help, and guide and nurture these people through it. And that's really one of the biggest things that we've noticed is through this COVID environment, how bad it is out there. And there's so many more people that need help because we have the opiate crisis. Yes, we do. Our model has kind of shifted organically, and we're really about 90% alcohol,
which is a big change.
Huge change for us, because when we opened 5 years ago, we were straight opiates, Xanax and heroin and anything that you could ever imagine, right? And now it's all changed. So the cool thing is we train staff every month. We have trainings and we work on it. And I always have my finger on the pulse, always, because I have to direct and lead this. So when you shift from this opiate base of what we did, right? We have 40 beds and it was all opiate, right? And now you've got 40 beds and now 35 are alcoholism. You have to kind of shift that mindset, right? And when you have a 50-year-old that comes in with these type of situations going on, staff has to adapt that too, right? So if you have younger staff, they have to click with that older, and it could be challenging. And that's where I'll step in, or some of the elders will step in and kind of help those people through that. So it's super important.
How is it, and you mentioned the staff having to shift. How difficult or easy is it for them to shift, knowing that they're going through this pandemic as well? Their COVID is affecting them, and they're having to treat the patients who are in recovery.
Yeah, I mean, in the beginning when COVID first started, it was a challenge for us. It was I'm not going to, but it was a big challenge, and we had to work really hard. The entire staff worked so hard on getting everybody to feel comfortable. And there was a point in time when we had a mindset years ago that we have warehouses full of supplies. So when the pandemic hit, you couldn't get paper goods at Costco and everybody was sold out everywhere. We were okay. We had gloves. We already had masks. We had a lot of stuff, right? So getting people trained to be comfortable and know that it's okay, and come to work and treat these people that want help, right? So the interesting thing is we didn't slow down. We got busier through COVID. And I'm so grateful. We had 2 cases of COVID all year out of 40 beds. People come in, we test them, we'll isolate them. We did everything that we could do, and not one employee got COVID while we were processing through it. Yeah,
beautiful thing.
Yeah, it was.
And now that a lot of folks are getting vaccinated, is that changing anything at all? Are folks more comfortable with coming to treatment? Do you see any change at all, or is it still the same over the past year?
I mean, we had a gal last week. She said, I got to wait for my second shot and then I'll be out. But no, not too much.
So I mean, we're kind of at the tail end of the pandemic. COVID has obviously caused major changes. What's the future look like? I mean, you're doing it every day. You're boots on the ground. What do you see, with who knows with COVID, how long COVID's going to be here? What does the future look like?
Well, look at it. We still have the opiate pandemic that's out there. That's horrific, right? It's still out there. Real can be, especially with fentanyl and it being so dangerous. We have the alcohol situation going on. That's going to carry us through. It really is. We're actually planning another growth because there's such a big community that needs help. I remember I read a statistic, and it was a couple years ago. There's 20 million people in addiction in the country, and there's less than 2 million beds. So we have a big want. There's a need out there. Humbly, we have a really good brand, and I'm so proud of that because it shows how our staff pours our hearts out, and the reviews are really good on our facility because we care, and that's the biggest thing. It's not about numbers; it's about the quality of care you give. And I tell my staff, this is the main thing. We're going to be clean like the Marriott, and we're going to have a Nordstrom style customer service. Okay, because you can't beat that.
That's right.
Right? Or you go to Chick-fil-A and the service is incredible in the drive-through. You have to have a smile. You have to remember that when people come in and they're difficult, that was you. Because we all went through this recovery process, right? And that was you being difficult. So you love them through that. So we're going to add some more beds here coming up. And then we're going to make a shift also because of one thing that I tell you, I'm a good visionary, and I see where there's sectors within the healthcare industry where people need help. And one of the areas that we're going to go into is the autistic care. There's such a huge need for these kids, and it's interesting because several people that work in our facility help these kids in high school. My daughter did in high school. She went to the special ed deal. She helped these kids, and it's a heart, man. You have to have the heart to help people, right? And there's 1 out of 4 kids has autism these days. Okay, and this is a big problem. And the quality, they have trouble getting good care. There was an article that my CFO sent me last week in a newspaper about how families are struggling to get really good quality of care out there. So we're going to make that move, and we're going to dip into there a little bit and work with that. But we'll never forget where we came from, and we came from the recovery world. So that will always be a staple because that's in our heart, right? I was helping addicts. I had family members that were heroin. One of my family members was a heroin addict for many, many years, and I tried to help him. I didn't know what I was doing. I just knew the kid needed help, and he was bad, right? And then all of a sudden, a bunch of stuff got stolen out of my garage, the typical story, right? And at one point in time, I realized I really couldn't help him, but I wanted to help him so bad. And then some other family members got into some other stuff, and I tried to help them, and I knew it was in me, right? Because I have another business that I've owned for 40 years. But I love coming to Melrose. I love coming to this business every day. When I'm in town, I love coming there and spending time in groups with the clients, listening to their stories, sowing seed into them. Because remember, no matter what, it's about planting seeds with people, and we plant the seeds. They might not listen to you at that moment, but in a week, a month, a year, they're going to reflect back and go, remember what John told me, remember what Tammy told me, and it sunk in. And that's when they start to make that change, because we can all change our lives, but it's one decision, right? And I tell our clients, we're one decision away from changing our life. That's it. It's a hard decision, I get it. But once you make that decision and you just put your feet in the ground, yeah, you're gonna have some bad days. You're gonna go through some stuff. You are, but we're tougher than we think we are, because really deep down, and we're all babies and we all cry when, but we're tougher than we think.
That's true.
Because we've all been through something 100%. And we look back and go, man, I didn't think I was going to get through that, but I got through it okay, right?
That's right.
Right?
That's right.
So we're there to support them. We're there to love them, encourage them, give them hope, show them what life could look like, right? And now it's up to them, because I can tell you literally dozens of stories where young women came through the program that lost their babies. We helped them get their babies back. They're still clean today. I mean, the stories are endless of the work that we did. A little bit of that. They did the big part because they made the decision. We just support them. That's our job, right? Is to support them. So that's, you know,
and like you said, we all need support.
That's it.
Nothing can be done alone.
Well, and encouragement is so, to me, encouragement's underrated, right? Because the more you encourage everybody, the better the energy is in the room. Like I tell everybody, it's our job to create the atmosphere, right? And the atmosphere, for it to stay high, the energy's got to high. You know, like if you call somewhere and they answer the phone, you can tell if they have a smile or they're happy or they're not.
Yeah.
Well, that has to be the way we portray ourselves too, right? We're all going through something, but it's okay. We've got to be grateful for the day, because it could get a lot worse. It could be worse, right? And now come in knowing that we get to do this work. See, we don't have to do this job.
That's right.
We get to do this. We get to help people that come in. I had a guy come in. He was drinking a half gallon of whiskey in a day and a half. Every day and a half, drinking a half gallon of whiskey.
Wow.
And he made a decision, and we supported him. You follow me?
Yeah.
And we encouraged him. And I still talk to him, and I still encourage him. And it's amazing what that encouragement can do, because with love and hope and encouragement and a little guidance, I don't care who you are, right? When it's sincere and they see the passion in you, and I can tell you, my staff is amazing. They get all the credit, right? Because without the staff, we're nothing as a company. So that's why we train, and that's why we care. And I take my time as best as I can do to spend time with my staff as much as I can, and just sow into them, you know, because this is life and death type of stuff, and it's real. With Mental Health Awareness Month, let me tell you, it's bigger than people think. Every client that comes to our facility, there is an underlying mental health situation going on, and you got to understand that, right?
It's undertreated.
Very much.
This country.
Very much.
Yeah, absolutely. Speaking of mental health awareness, I know June is Father's Day coming up, and you know, you talk about the average age is 40, 45. You're a father.
Mm-hmm.
You know,
and a grandfather, proudly, 5 times.
Oh, well, see, here you go.
Yeah.
I mean, how do from your perspective, how difficult is it, from a father's perspective? I mean, if you can kind of put yourself in your client's shoes, or some of them are fathers. I mean, how difficult is it? I mean, if you're in treatment and you're a father, or if you're putting your child in treatment, I mean, from your point of view, if you can speak to it, but just based on the patients that you see and talk to. I mean, I couldn't imagine. I had it in my family.
Yeah. We've had an addiction problem in my family.
Yeah.
So yeah, it's one of the hardest things to deal with, but you got to understand them, and you have to love them, and you have to guide them. Tough love doesn't always work on everybody. It depends on the personality, it depends on the individual. And I have a lot of parents that will call up, and they don't get it, and I'll spend time, and I will personally talk to them and try and get them to understand, because part of what I do as a life coach and a mentor is help people get through their situation. I've had parents call up, why can't they just get off this? It's not that easy, because you were never in addiction. Right. You don't understand it. It's a lot harder than you think, right? Or a spouse, maybe one spouse is drinking and becomes an alcoholic, the other doesn't, and doesn't understand it, and violence comes into play, and a lot of stuff, bad stuff goes on with that. So it's just, from a father's perspective, just loving, guiding, and trying to help people understand what that individual is going through. Right. Because when you get to the point where these people there's something going on upstairs. We all have something, but we all handle it differently. Right. Everybody handles everything differently. Right. So you can't really compare with what one person is doing with another. You just try and get in their shoes, talk to them, try and understand them, and try and get them back over if they're open to it. Right, because they're not always open to it.
And that's the key. You have to be open to it, right? And not everybody's open to it. And I think I've heard some people, to that point, some people think that being an addict or being an addiction is a choice. Right? And yeah, what would you say to somebody who says that? When someone says, "Oh, well, you choose to be addicted to a substance," I mean, you see it every day.
Mark,
so,
it's so hard. Nobody chooses it.
Right.
Right. They get trapped. There's something underlying. They use, whether it's an opiate or weed, in my opinion, I'm not a fan,
Yeah.
or alcohol.
Yeah.
They're masking something, they're hiding something
Right.
from, they don't want to deal with something.
Right.
Right. And that's what we have to try and get people to understand, that there's something more underlying.
Right.
And that's what our therapists are really good at doing,
Yeah.
is getting in there and trying to help them through. But again, like you said,
Yeah.
they've got to be willing. Right. But we're patient and we're consistent, and we'll work as a team. We'll get the therapists and the counselors and our clinical director involved. And if I need to step in and get involved, I'm glad to.
Right.
Because that's what I love to do. And just, our job is just to help everybody through and try and get them to understand that.
No, absolutely.
Yeah.
So I guess, what would, for people who are listening, or people who maybe will listen or watch this later, how do they get into treatment? I know you've got 3 facilities in Southern California. What would you tell the audience? If you know someone who's struggling, if you have a family member, who should they call? Or any advice you would give them?
Well, I've got 2 admission guys that are outstanding. They've both been through recovery. They have so much passion. They're so good at what. These guys take calls. We're on the East Coast. They'll take calls at 2 a.m, whatever it is.
Yeah.
And they have so much passion to help people. Even when people call our hotlines to get in, even if we can't help them, we'll find a place that'll help them.
Right.
And we've got a situation right now going on, and it's a child, and the mom's calling for the family, and we aren't able to help them. But Michael, one of our admission guys, he has got such drive and passion, and he is going way above and beyond to help that family find a place that fits their needs. Right. And that's just what we do.
Right.
So, you can always find us at melroserecovery.com. And it's, 1-800-217-3710 is a number. And whether, we have we got several people that we do business with that have sent their family members to us. So they trust us, and that's the biggest thing, right? You got to trust where you're going.
Exactly.
Our hearts are in the right place, and it shows.
I know. No, I appreciate it. I think that's that's something we're pretty much good for now. I really just wanted us to go into what you see for the future, which we talked about. I don't really. I think the next year is going to be pivotal. The next year. And then.
Yeah.
If you have any thoughts on the next year, you kind of answered it, but I think next year's gonna be pivotal with COVID, with the vaccines.
We're definitely not going anywhere. There is, honestly and openly, a lot of the bad players are gone out of the game, and we needed that to take place.
Yeah, absolutely.
And so we're growing. Yeah. There's a need, there's an opportunity to help people. Yeah. We are going to grow, and that's just where we're going. So next year is going to be this year's a good year. No matter, forget COVID and look past it. Yeah. We're having a great opportunity to help people more than we ever have. Yeah. We are growing again. We're going to add about 20 more beds here in the next few months. And so we're just going to keep on the path. And it's good that I have such a good staff that I can get out and continue to steer and lead the ship right in the direction that we're going. Right. And they know we're going, because they trust me in my direction, because when I tell them we're going this way, we go that way. Right. We all jump into it together. Right. We're a company we're a team as a company. We make decisions together as a team. It's not just one person making the shots. Right. I consult my top people. Absolutely. And then we'll go down and ask some of the people on the ground. Right. Who knows better than the people on the ground? Nobody better, right? Nobody Everybody's better. Into it. They want to grow. They know there's a need. And we're just going to go after that, because all these people need help. And a lot of people don't even know where to go.
Exactly.
They don't.
Exactly. Exactly. Well, you're doing good work.
Yeah, thank
Doing
you.
good work.
Yeah, you are too. You've come a long way.
Yeah. I know it's been, it's been 5 years since we,
Yeah.
yeah.
Yeah, super proud of you.
I remember, thank
Super
you.
proud.
We're walking into your facility, brand new to.
Oh, yeah.
I was a rookie.
And now what are you here?
I'm the senior VP of implementation operations. So I head up the service team here with myself and the COO. So no, it's been a heck of a ride. I've learned a lot from you and your team. I mean, I've been to your facility, and so I mean, it's really, for me, it's encouraging to be at this table with you and to see how we've both grown, and you guys are doing good work.
No, it's an honor. It's not really an honor to be here. Yeah. And yeah, you come a long way from LA now to living in Miami. Yeah, it's good stuff. So we're proud of you too.
Well,
so thank you very much.
Well, thank you, Walt.
Yep. Honor to be here.
All right,
thank you guys.